So Cushing's disease is also called hyperadrenocorticism, and this is when the adrenal glands are overactive. There's three main causes of Cushing's disease, and first we're going to talk about the most common one, which is a pituitary gland tumor. Tumors will cause an overproduction of ACTH, which then stimulates the adrenal glands to produce cortisol. A pituitary gland tumor will cause an overproduction of ACTH, which will trigger the adrenal gland to start producing cortisol, and that will result in excess cortisol in the system. If the adrenal gland can be controlled, then dogs can live completely normal lives as long as they're taking medication. And if the tumor starts growing in size, then that's when they'll start to see neurologic signs. For this type of Cushing's, the most common treatment is going to require medication. The two most common is trilostane and mitotane. The second cause of Cushing's would be an adrenal gland tumor. If the tumor is benign, then having surgical removal will completely cure the disease. But if it's malignant, surgery may help, but the prognosis is much less favorable. The treatment for this type is going to be surgery, but if that's not something that's possible, being medically managed is always an option. This is going to require a lifetime commitment. They're going to need to be monitored by blood tests along with clinical signs. You're going to want to get routine blood tests to ensure that the dosage that the patient is getting is going to be effective. The third and final cause of Cushing's is going to be iatrogenic Cushing's. This is going to be excessive amounts of cortisol being produced by being on a long period of steroids, and this is either injectable or oral steroids. For treatment of this type of Cushing's, you're going to want to slowly back off of the steroids that they've been on over a period of time. If you do a fast drop in the steroids or completely cut them off from it, it's going to have adverse reactions like hypoadrenocorticism. Unfortunately, whatever the steroids we're treating, it's most likely going to end up coming back. There's going to be three main ways to diagnose Cushing's. The first is going to be an ACTH stim test along with a low-dose dexamethasone suppression test. You can also do a high-dose dexamethasone suppression test along with a urine cortisol to creatinine ratio. The last diagnostic tool that you can use is an abdominal ultrasound. This will be helpful in determining the size of the adrenal glands along with if there's any tumors on the adrenal glands.